Guys, relax. It's just a cough.
Yeah, maybe it's just a cough in the middle of a pandemic.
Well, what do you want me to do?
Why don't you try asking someone for help? A pharmacist, perhaps.
In case you guys forgot, we are the student pharmacist.
Yeah, that helped me a lot.
Heavy coughing with phlegm, huh?
I think he needs a drug that improves mucociliary clearance, making phlegm easier to cough up and expel.
Yeah, exactly. And expect her to be more precise.
And I think Ambroxol will be the best choice. Am I right, Queen?
In that matter, what is Ambroxol and when should we take it?
Well, Ambroxol is an expectorant that is used for the treatment of respiratory disease that is associated with the mucus hypersecretion.
By making the sputum thick and less viscous and quick to cough out, this medication used to relieve the state of shortness of breath, constant cough, and inflammation of the lung airways.
It is an over-the-counter drug which is known with its generic name Ambroxol hydrochloride or just Ambroxol. It is available in the market with the brand names Ambrolex, Expel, Mucosol Van, Zolvexol, and so on, which is available in syrups and tablets.
So the indication includes all forms of tracheobronchitis, emphysema with bronchitis, pneumoconiosis, chronic inflammatory conditions, bronchitis with bronchospasm, and asthma. During acute exacerbations of bronchitis, it should be given with appropriate antibiotic.
There are actually no absolute contraindication, but with patients with gastric ulceration, relative caution must be observed. Precautions must also be taken notice, especially during the first trimester of pregnancy. It is actually advised to just avoid taking this med during this phase.
Occasional gastrointestinal side effects may occur, but these are normally mild. Other side effects of Ambroxol hydrochloride involve nausea, vomiting, diarrhea, skin rash, itching infections, allergies, upset stomach, dizziness, weakness, dry mouth, indigestion, numbness in throat, numbness in mouth, and taste disturbances. There are generally no adverse effects attached to this medication aside from the intensity of the entailed allergic reactions and other effects.
Now that we are at full throttle with all these drug discussions, do you guys still remember the guidelines taught to us which we must apply when we practice pharmacy in the future?
Of course, first, we must not miss a single needed information in labeling prescription. It is also a must to give the patient concise and precise instruction to allow better understanding.
And to avoid confusion with the proper administration of the medication.
Aside from those things, Noel and Mary, we must also not forget to input the drug's expiration date alongside with its required storage condition.
Hush now, you guys. Hey Jason, maybe you should wear a mask and go to the pharmacy.
What do you think are the most preferable brand, guys? Should I get the most expensive one for better results?
Brands don't matter, Jason. Anything under the generic name Ambroxol hydrochloride works the same. Well, maybe some brands' formulation suits you better than the rest, but at the end of the day, they all have the same effect. And your pharmacists probably know what's best for you.
Yes, Gwen is right. Actually, there has been an act passed to ensure the continuous provision of quality drugs but at a cheaper price. You just have to be smart and efficient choice. And also, you must pay close attention to your pharmacist's advice.
If I'm not mistaken, this act was known as the Universally Accessible, Cheaper, and Quality Medicines Act of 2008, or the Republic Act number 9502.
Guys, I think Jason really needs to go. Lunch break is nearly over.
Kylene has a point. Jason, you should really go now.
Thank you, guys.
Bye-bye, buyers.